Hello dear all, I am Vishaka Birhare, Assistant Professor, Department of Economics from the Bhopal School of Social Sciences. In the previous modules, we have discussed about the population size, distribution, rural-urban classification of the population and sex ratios in India. Now, today in this module, we are going to discuss about the National Population Policy 2000 and make a critical assessment of the same. So, let us begin. The policy to control the rapidly growing population and to stabilize it at a reasonable level has been there since early 1950s, with some variations in it since then. The latest in the series is the National Population Policy 2000, announced on 15th February 2000. We will be describing the silent features of the Population Policy 2000 and making a critical assessment of the same. The policy has majorly set three objectives to be pursued. The immediate objective of the National Population Policy is to provide for the facilities to meet the unmet needs for the contraception, healthcare infrastructure and health personnel, and an integrated service deliveries for the basic reproductive and child health care. The medium-term objective of the population policy is to bring down the total fertility rate to the replacement level by 2010. Now, the total fertility rate is the average number of children per woman in the reproductive age group, whereas the replacement level is the amount of fertility needed to keep the population same from generations to generations. Moving ahead, the long-term objective of the National Population Policy is to stabilize the population by 2046. In pursuing these objectives, the policy stipulates the fulfillment of the following goals: reduction of infant mortality rate below 30 per 1,000 live births, reduction of maternal mortality rate below 100 per 1 lakh live births, universal immunization to achieve 80% deliveries in regular dispensaries, hospitals and medical institutions with trained staff, access to information containing AIDS, prevention and control of the communicable diseases, incentive to adopt two-child small family norm, facilities for safe abortions to be increased. Apart from that, strict enforcement of the Child Marriage Restraint Act and prenatal diagnostic tests, raising the age of marriage of girls not earlier than 18 and preferably increasing it to 20 or even more than 20. A special reward for women who marry after the age 21 and opt for terminal method of contraception after the second child. Health insurance cover for those below the poverty line who undergo sterilization after having 2 children. Immediately, to improve the health infrastructure, an additional allocation of rupees 3,000 crores is required so that the unmet needs of the contraception can be taken care of. Now, to achieve these aims and objectives, the action plan which was drawn for the next 10 crucial years included several things. Self-help groups at village panchayat levels comprising of housewives will interact with the healthcare workers and gram panchayats. Elementary education to be made free and compulsory. Registrations of marriages, pregnancies to be made compulsory along with the births and deaths. To ensure coordination of work between the panchayats and the nagar palikas with different state governments of the states and centre, and also between various departments, the policy has provided for new structures. For example, the National Commission on Population and identical commissions at the levels of state and different union territories. A coordination cell has also been set up for the same. The policy also seeks help of the non-government organizations and Indian systems of medicines and homeopathies. Apart from that, increase in the employment opportunities for women, encouragement to the contraceptive technology, incentives to popularize small family norms are in the form of cash, kind, insurance benefits, besides the public applause. These incentives are given to the families with 1 or 2 girls, couples below poverty line, those who marry late, those who bear children late, those who adopt a terminal method after the birth of the second child. Moving ahead, let us now see how the National Population Policy 2000 has been critically evaluated. Overemphasis was given to the contraception, but it was observed that if the population problem is to be solved in this country, frontal attack has to be made on poverty, especially in rural areas. Kerala, Tamil Nadu and Goa, among the states in India, have successfully brought down the birth rates from 35 to about 15 per thousand in the period of 25 years. Attitudinal changes to health and family size in these states, reducing birth rates, became possible largely due to spread of literacy, especially among women, and their better health care. The policy was soft on the male participation because it is clearly observed that the policy provides incentives only to women to accept terminal methods of contraception after the second child. Hence, the entire burden of the family planning was on the women. Apart from that, less contributions of vasectomies of men than that of tubectomies of females. It is observed that vasectomy accounts for only 6% of the current usage of contraceptive. Apart from that, the policy has more dominance of bureaucracy. Despite several incentives, the performance has been less satisfactory. Incentives have led to corruption. As a result, Swaminathan Committee recommended that these incentives should be discontinued. But as we all know, incentives are necessary for a program which is purely voluntary in nature. It is observed that, like the earlier policies, even this policy is weak in implementation. Yet, it is likely to achieve more than before because it is better conceived and rightly focused on the central issues of population growth. So, that's all for today. I hope this video helps you to understand the National Population Policy 2000. Thanks for watching.